Hey everyone, we are in the midst of a pandemic, and Malaysia is starting its vaccination program. And recently, there's a video that came out from a doctor, Dr. Roland Victor, who spread quite a lot of fear and vaccine hesitation. And I thought I would make a rebuttal to address some of the claims made by him in his video. Let's go.
Orang-orang frontliner akan jadi test bed ataupun mereka akanlah orang pertama akan jadi acid test. Dia akan kena acid test ni untuk tengok sama ada mereka sendiri nak ambil vaksin tu. So you guys yang duduk diam-diam tak nak komen apa-apa, nak kata padan muka tak nak lah.
So right off the bat, this Dr. Roland Victor is saying that the frontliners, the staff that are about to be vaccinated, they will be the acid test for other people, like I presume the politicians or even the rakyat jelata, the people, to see if the vaccine is safe and effective. Then only other people will take the vaccine. That's what it means by the acid test, right? The acid test by definition means a test that a thing goes through to prove that it is effective. Now in this case, it doesn't really apply to the Pfizer-BioNTech vaccine. Okay, now I'm not being paid by Pfizer or any other big pharma companies to say this, but I'm just reading the research and the news reports. There's no need for an acid test. The Pfizer-BioNTech vaccine has already proven to be effective in lots and lots of major trials. It's proven to be effective and safe. We should take the vaccine. Again, this is classic misleading and misinformation. But let's go on.
Conditional registration for pharmaceutical product during disaster guideline. Disaster ni so kira macam dalam satu keadaan bencana, keluarkan apa-apa ubat yang mungkin boleh membantu untuk mengurangkan bencana tu.
Okay, he's saying here that Malaysia has gotten some sort of conditional emergency approval for the Pfizer-BioNTech vaccine. And just to clarify, even a country like Singapore, its own authorities have approved the Pfizer-BioNTech vaccine via a special pathway to justify using it during emergency. So, I don't see a problem with this.
So, apa yang menarik anak share is side effect. 1 daripada 10,000 orang boleh mengalami simptom paralisis muka ataupun cacat saraf muka dia, facial nerve dia, untuk seketika. Mungkin seminggu, 2 minggu, 3 bulan, 6 bulan dan sebagainya. So benda tu yang bila I tengok tu like, hey.
So it has been shown that the vaccines may not technically actually cause the Bell's palsy, which is the paralysis of the face that he has mentioned. In fact, sometimes the studies have shown that the incidence of Bell's palsy in the background is the same as with those people who took the vaccine. Meaning, these people would have gotten Bell's palsy anyway, even if they had not taken the vaccine. A simple point to summarize is this. A correlation is not causation. Okay, if two things seem related to each other, that does not mean that A causes B, right? For instance, let's just say that in the month of February, there has been more rain. Okay, and in the month of February, I have gained weight. That does not mean that rain causes Jason Leong to become fat. You understand? Correlation does not mean causation. So in this current climate, it has not been definitively proven or shown that vaccines cause Bell's palsy. In the very same way, no one has ever been able to prove that vaccines cause autism. So there is no need for this kind of fear-mongering and misinformation. Hey, what if you take the vaccine, you get Bell's palsy, you know? That's very irresponsible.
Maka akan adalah mungkin 50 atau kurang orang ada simptom yang macam mulut dia batuk, mata dia jatuh macam tu.
So which is preferable to you? 50 people getting Bell's palsy, which is not permanent, or let's say hundreds of people in the ICU, hundreds of people requiring ventilators, tens and thousands of people in quarantine, thousands of daily new cases, billions in businesses lost, hundreds of deaths. Which do you prefer, right? You see, when it comes to these kind of cases, when authorities approve vaccines or approved drugs or medication of any kind is always on the balance of risk. When the benefits far outweigh the risk, then they are allowed to sell the drug, or in this case, sell the vaccine. It's always on a balance of risk. Risk will always be present, but that doesn't mean we should ignore a particular drug or a particular vaccine just because we are going to lose out on the potential major benefits those drugs and those vaccines may confer to us. So again, there's no need to spread this kind of fear and misinformation.
You get the virus kalau 2-3 hari sesama ataupun batuk, I rasa I lebih suka dapat virus tu 2-3 hari I batuk sesama daripada I nak suka-suka ambil.
12 minutes into his video, we have come into the most, I would say, blasphemous and the most irresponsible part of his video. Because you see, in the context of him being a person of authority, a doctor saying in front of the camera, broadcasted to, on social media, that he would rather have COVID than take the vaccine. I cannot think of a stronger word other than irresponsible. This guy is really irresponsible, okay? And it doesn't make sense, right? It's so ridiculous because you would rather face the potential complications of having COVID-19, which could be lung damage, you may not, you're in the hospital for prolonged periods of time, you may die, people may have to go into quarantine, do not see their loved ones for extended periods of time, businesses will close, you may harm your close contacts like your young children or elderly parents. You would rather go through this entire plethora of bullshit when it comes to getting COVID-19. You rather this than, say, taking the vaccine and possibly having some minor side effects like bruising in the arm. It boggles my mind that someone who is in the position, who has studied medicine, would rather go through the disease than prevent the disease. I thought one of the first tenets of medicine is that it's prevention is better than cure, right? So vaccine is one of the best ways to prevent something. So why not prevent something rather than going through the whole process of curing it? Would you rather have polio, tuberculosis, mumps, rubella instead of getting vaccinated against those diseases? Well, yes, your body may fight off polio on its own and you'll be fine. But on the other hand, you may be paralyzed in one leg or both legs or from your waist down, from your neck down. So on the balance of risk, this makes zero sense. And again, I have to emphasize that this part of the video, his video, is the most irresponsible, the most dangerous, and it needs to be shut down. Okay, Dr. Roland Victor, I do not know you. You seem like a nice guy, but for that statement alone, you should be ashamed of yourself.